what are some of the gaps in knowledge in what we know for kind of helping and treating and identifying
Mhm.
infants with sleep apnea?
So I think there is a lot of gap in knowledge. And the reason is for the longest time, we have thought that sleep apnea in older children is similar to having sleep apnea in infants. But as we learn more about the anatomy, we are realizing that that is not the case. As I mentioned, in infants, their upper airway is more collapsible and it is still soft. The tissues are still growing. So whenever, if you think of a pipe, uh, it is more collapsible, right? It's not as stiff because there aren't muscles surrounding it and keeping it nice and wide and open. Infants are more at risk because that's how they are born. And it's only after they are 1 to 2 years of age that they gain that strength that they can keep their airways open. So I think starting off, just knowing that this anatomy is different and knowing that these infants will behave differently is very important. The one of the biggest things I think that we need to look at right now is how do we identify infants who are at risk for sleep apnea. Now, sleep apnea, the way you would diagnose it is by doing a sleep study. And sleep studies are expensive and they are technically very challenging in the infant group because if you ask any parent of a newborn, it's really hard to keep your child asleep. And if you have like millions of wires in the child, then that's going to be harder. So we need different diagnostic clues which can help us streamline the process and decide which infant needs testing. So the second thing that we would need to look at is what are these other comorbidities and identifying the at-risk population. And that is what our group did with this study. The third step which we need to take is to decide how are these comorbidities and how is sleep apnea affecting the child. What we do know is that even with snoring, infants who present with snoring, they have been shown to have some developmental challenges as they grow a year or two older. But we don't know what the long-term effect of that airway obstruction is on that infant's developing brain. So the third step would be looking at the neurodevelopmental outcomes in these infants who have sleep apnea.
And my final question then would be, has COVID-19 impacted infants with sleep apnea at all?
So although what we do know about COVID-19, and we are learning every single day. Now, if you look at all the case reports that we have seen of diseases being seen in infant group, yes, the infants are as such, as a group, they are at higher risk because they have more immature immunity and they also have significant smaller upper airway. So imagine again that pipe, that collapsible pipe, and if you have a virus hitting that, you have a lot of swelling. So the airway through which you're going to breathe, that's going to narrow down further with the viral infection. So potentially it could definitely be the infants with sleep apnea may be at higher risk. However, there just hasn't been enough data that we can conclude saying that yes, they are at risk or these are the number of kids who get affected by COVID-19. But for sure, I think they would be at more risk because of their pre-existing upper airway obstruction.